Right. Good afternoon to everyone, and welcome to the RCC Roundtable. We are so excited to have such a great panel of speakers today. And thank you to those who are joining us again today, who continue to support the RCC Roundtable. And welcome to those who it is your first time joining us today. Today's roundtable is all about highlighting Suicide Prevention Week. So again, like always, we love for you to engage with us. So if you have any questions or comments, please do not hesitate to drop them in the chat. So now I am going to turn it over to Lifeline's our suicide prevention coordinator, Catherine Rogers.
Hey, thank you, Kelsey. I just want to thank everyone who's with us again for coming and being with us in person and over Facebook Live. I do appreciate everyone's attendance today. So I'm going to briefly go over our introductions for each person. So today we have Mrs. Lydia Barber. Mrs. Barber is the coordinator of the South Alabama Out of the Darkness Walk that takes place in Daphne, Alabama every October. She has been organizing this walk for 11 years. It benefits the American Foundation for Suicide Prevention. She has also been a board member of AFSP Alabama chapter for 2 years. She is also the co-facilitator for Eastern Shore Survivors of Suicide Support Group in Fairhope for the last 8 years. Mrs. Barber became active in the AFSP and suicide prevention and awareness after her family tragically lost their oldest son, Alan, in October 2010. Thank you for being with us today, Mrs. Barber. Mrs. Katie Bourget. Ms. Bourget is a mental health counselor for the Alabama Head Injury Foundation. She has also worked in suicide prevention nonprofit management for the last 4 years and is currently working to build a network of suicide prevention professionals and advocates across the state of Alabama. She is a licensed QPR gatekeeper, trainer, and loves teaching people how to support those who are in a crisis. Thank you for being here, Mrs. Bourget. Dr. Erica Butler. Dr. Butler has worked in education for over 20 years and is currently employed with the Alabama State Department of Education as an education specialist too. In this role, she is responsible for conducting professional development opportunities aligned with school safety. Additionally, she researches and develops best practice documents as it relates to trauma and crisis management, and she provides leadership and technical assistance to local education agencies as it relates to review of trauma and crisis counseling services. She is a member of the Alabama State Department of Education, Suicide Advisory Committee, the Alabama Education Association, and the Delta Sigma Theta Sorority, Montgomery Alumni Chapter. She attended the following universities: Auburn University, where she received her BS in Business Administration, Troy University, where she received her master's in community psychology, and Nova Southeastern University, with an educational organizational leadership program. All right. Thank you for being here, Dr. Butler. Mr. Harold Colbert, did I say it right?
That's correct.
Perfect. All right. Mr. Colbert, after retirement in careers in industry and real estate, has worked in suicide prevention in Alabama the last 6 years. He organized the SAM Foundation on behalf of the family of Sam Johnson and served as its first president. He also organized and served as a treasurer of SPNA, which is Him and his wife, Teresa, have lived in Decatur for over 40 years and are active in St. Andrew Presbyterian Church. Thank you for being here. Miss Megan Ford. Miss Ford is a passionate public health and mental health professional with 5+ years of experience within the state government facilitating health promotion and prevention efforts. She is a graduate of Tuskegee University with a bachelor's degree in psychology and a master's degree in public health. Ms. Ford is a member of the Suicide Prevention Network of Alabama, SPNA, and served on the Suicide Advisory Committee with the Alabama Department of Education. Ms. Shondalyn Elliott Johnson. Ms. Johnson is responsible for the management of Project Aware grant through SAMHSA. This requires traveling to various school systems to advocate for mental health awareness, acceptance, and to train on the comprehensive integrated 3-tiered model of prevention. In addition to this training, she is also the state of Alabama's coordinator for youth mental health first aid training. She also assists with the promotion of anti-bullying initiatives to local school systems throughout the state. All right. Dr. Vanessa Miller-Curtis. Dr. Miller-Curtis is currently an assistant professor of psychology at Athens State University in Athens, Alabama. She holds a PhD in cognitive psychology with a specialization in cognitive neuroscience from the University of California, Riverside, and a master's degree in clinical psychology from Chapman University in Orange, California. Dr. Miller serves as the psychology department faculty advisor for the undergraduate internship program. She is a faculty sponsor for the Active Minds mental health group on campus and is an advocate for mental health and suicide prevention. Through grant funding provided by the Alabama Department of Public Health, Dr. Miller-Curtis and a team of undergraduate students have been able to develop a comprehensive suicide awareness and prevention program on campus. Once again, thank you all for coming and being here with us. So I thought that it would be great to start all of this off with some statistics of suicide and suicide death rates in Alabama and nationally. So as many of you already know, death by suicide is the 10th leading cause of death in the United States for all ages. But it is the second leading cause of death for youth and young adults ages 10 to 34. In 2019, we had 47,000 plus individuals who died by suicide. And we had an estimated 1.38 million who attempted suicide in 2019. In Alabama, suicide is the 11th leading cause of death. And the majority of suicides completed in Alabama are by firearms. We have a suicide rate of 16.8, which is higher than the US average of 14.8. And it's been that way since 1990. So what are we doing to prevent this? What is suicide prevention all about? I thought we could talk about prevention education first. Opening the floor.
Well, I can start if you want.
Yeah.
So speaking from like the student undergraduate perspective, I mean, one, undergraduate students already are stressed out and pose a lot of challenges to their mental health. But looking at just our school at Athens State, we're a 2-year upper division school. So we're a junior, senior only school, and we're definitely a non-traditional school. A lot of our students have families, they're older, they work full time. So there's a lot of demands on their time. So I think one of the biggest challenges is identifying students who may need help, because we don't really have a mental health center on our campus. And then also making students feel comfortable, how do they reach out? Who do they reach out to? And that's been part of the work over the last several years, is not only, letting students know, who's available, but also letting faculty know, so that faculty can connect students who may be having difficulties. So part of for me, the education is really, awareness on our campus, breaking down barriers, and then, putting faces with names and making things essentially non-threatening. So creating activities or events or just non-threatening situations where people can feel comfortable to come and talk.
Thank you. Yeah, that definitely hits the college age. What about our grade levels? What's being done with our Alabama school district?
Okay, I'll start with that, and then Mrs. Elliott Johnson, if you want to chime in, please do. One thing that we have done recently is to offer all of the K-12 schools a revised suicide prevention training that consists of resources as well as a protocol with interventions, preventions, and postvention steps for the faculty and staff. In addition to that, they are required annually to get training. That's all of the school personnel, the certified as well as the non-certified. And in regards to the students, they are required to offer a curriculum or program for all kids that are age appropriate for them and their level of understanding. And this is annually as well. Now, they have the option of providing this curriculum all year long, or just doing maybe one quarter or an entire semester. But as long as they touch upon the subject of violence prevention and suicide prevention, and they know who they can go to in the event that they need to talk to someone. And recently I have, since school has started back, I get crisis reports from all of the school districts that have something going on as it relates to suicides, suicide ideations, any natural disasters, anything going on in school. Maybe the school had to go on lockdown because there was a shooting or a robbery or whatever down the street. So I get all those reports, and I have received from September, no, I would say it was August the 28th up until today, I've received 54 reports. And out of those 54, 41 of them are suicide ideations. And this is from various school districts. So we are looking at some things that we can do, some trainings that we can implement for the faculty and staff, in addition to the training that they already have, but that will help them deal with these students who are reporting that they're wanting to hurt themselves. And I think for the most part, since kids have been out because of the pandemic doing virtual learning or whatever type of platform that they've been offered through their school districts, some of them are having a difficult time readjusting to in-person learning. And so many of them have dealt with things going on in the home, domestic violence, poverty, lack of food, all types of things. So they are really having some issues, and they're bringing that to school with them. Mrs. Johnson, is there anything you want to add?
Thank you, Dr. Butler. Absolutely. In addition to all that Dr. Butler has stated, she and I had the privilege of serving together as it related to the Suicide Advisory Committee to compose the document that she mentioned, which does in fact contain a suicide protocol that is utilized in every school system with the thought of the school counselor or whoever the principal's designee is, that at the time of a child mentioning a suicidal ideation, there will be intervention whereby the protocol will be highlighted, and in that protocol, it entails the catalyst. Students are asked what were the catalysts that may have contributed to their desire to want to move forward in their choice of wanting to end their lives by suicide. In addition to that, school systems are encouraged to have a suicide, and not just relegated specifically to this, but an overall school crisis advisory team, so that these individuals will know basically how to respond. And I think Dr. Butler did in fact mention that we want not only for them to have the opportunity to know who to respond to, but also how to respond in the face of a student who presents suicidal ideations. In terms of the adults, Dr. Butler mentioned we're moving towards individual trainings. And as mentioned in the bio, one of my chief responsibilities is to ensure that there is youth mental health first aid trainings that are conducted throughout the state. We are regionally based, though Dr. Butler and I work in the same area and the same section for the State Department. She would give credence to the fact that each of us are regionally based, which means that we have the responsibility of providing training, also safety measures, compliance monitoring, et cetera, for various regions in the state. And our overall goal, even as it relates to youth mental health first aid, is to ensure that the entire state of Alabama's adults are aware and participating in receiving certificate as it relates to having completed the training. The youth mental health first aid training, as many of you may be familiar with, is instrumental in providing the adults with the warning signs that could likely help us to be aware of what may drive a student towards contemplating suicidal ideation. And within that training, it is our hope that not only will the warning signs be provided, but also that we can do all that we can at the state level to ensure that every adult is empowered with his or her ability to help intervene, to prohibit the completion of suicide, and ultimately to curtail the number of suicidal ideations and reports like what Dr. Butler did in fact mention. So we're working diligently And with all that we're doing in compliance with the comprehensive suicide plan that we have conducted and completed, in addition to encouraging school counselors to be amenable to their comprehensive guidance plans and also to the suicide protocol for each student, we want to make sure that training is available and that adults do understand that there is a way to be made aware of the warning signs in an effort somehow to prohibit the completion of suicide by students and also to curtail their ideation. So currently, that's the direction whereby we're moving. We're also working in tandem with the Alabama Department of Mental Health as it relates to our school-based mental health initiatives to ensure that school systems throughout the state have on-site social workers, have on-site school-based therapists who can help in the event a student is threatening.
Thank you so much. That was a lot of powerful information and definitely powerful messages going out to families of Alabama, school, anything like that. What about other community prevention education? So I know we talk about mental health first aid with youth. I know some of us are adult mental health first aid trainers. So there's also QPR. Does anybody want to talk more about those programs?
I'll mention what our foundation, the SAM Foundation, provides. We're headquartered in DeKalb County and provide a variety of suicide prevention awareness training across also in Georgia, where we have staff in both Fort Payne and in Milton, Georgia. And we provide a variety of targeted suicide prevention training, QPR, for our general audiences, where you have a short window of a couple hours. We also sponsor all our suicide prevention training is free. And if it's not free from the provider, then we pay for it. We do mental health first aid. We do assist. We do AMSR from medical professionals. Those are the primary items that we do. We also provide train the trainers for those, and we've done mental health first aid certification, as well as we did 16 QPR, certified 16 QPR trainers in 2 years ago. So it's a multi-layered task. You have to have instructors, and then you have to have teach classes. So that's the thrust of what we do, among other suicide prevention services. And if you go to our website at samfound.org, you can sign up for any of those trainings, and we'll be in contact with you, and they'll be provided at no charge.
Yeah, Lydia.
I just want, that's excellent. I'm gonna have to look into your foundation. The AFSP has some programs out there, and I just wanted to let everybody know, we're talking about college. There is an It's Real college depression program that can be presented. It's a video, and then there's a talk afterwards. There's More Than Sad, which is the same thing, but for high school. These are, again, a program that is basically a video and discussion. And for the general public, there's Talk Saves Lives, which is what it is. It's just a general overview to teach the public about suicide. And those are the three basic ones. They are always coming out with new programs. And in the chat, it's afsp.org to find out all about our programs, but I'll put my area director's email that you can email her directly, and she'll be able to tell you anything you need to know. But those are the programs that we have, just some of them.
Thank you. That's definitely very helpful for a lot of people who don't necessarily know anything about suicide prevention. I know that QPR is a great introductory. Like, it's goes to like the meat and the potatoes of what you can do, how you can question, how you can persuade, and how you can respond. And there's actually a great turnout of people who are interested in that. And there are multiple places, even with the people here, that can teach those different aspects. So that's great. All right,
I just want to mention, Catherine, one thing that I left out, when the pandemic hit, we also certified instructors to do virtual training. And so now a lot of our training is done virtually, and we can go really anywhere in the world in most of the applications that we have.
Yeah, absolutely. I think that was a great thing of COVID, was we had to learn how to be virtual and offer that. Do we have any other comments on prevention education? Yeah.
And I think, kind of relating to the QPR mental health first aid, that's a lot of what we've been doing here at Athens State, and going virtual has really been a benefit. I mean, we've had a lot of students have gone through, especially mental health first aid, and faculty and staff. So it's been really, really successful here, and I've had nothing but positive feedback. So I would definitely encourage people, to continue to do the trainings, continue to offer them, take them.
Absolutely. Any other final comments on prevention education, community, grade schools, anything like that?
Catherine, one thing I wanted to add, we did in fact hear with regard to adult mental health first aid and trainings. Just this year, we're in our infancy stages as it relates to the State Department, with having so far in our department 2 who are trainers, myself and Dr. Marilyn Lewis, who couldn't be with us today. But also the same is true for what we're implementing now, which is teen mental health first aid. We are partnering with 2 school systems in the state of Alabama in an effort for them to be our proverbial pilot schools, so that we can ensure that the students themselves, of course, youth and adults, helps with the adults having the autonomy to know the warning signs. But teen mental health first aid is instrumental in making sure that the teens themselves, the youth, will be able to watch and notice the warning signs. And then it also promotes for them the dialogue that is necessary, how we not only gauge a conversation with another teen who may be in crisis, but we teach them how to directly ask the question, are you thinking of ending your life by suicide? And in that training, we eradicate several stigmas associated with the question of, do we cause an individual more harm by asking the questions? We teach them how to be direct, compassionate, yet direct, and not be afraid to receive and engage in those conversations that help us to be a lot more on the front lines from a team's perspective to try to avert suicidal ideations and completions.
Is the mental health first aid training that y'all are providing, is that funded at the state level, or is that coming through some sort of grant?
We do have grant accessibility for the completion thereof, and we partner with the National Alliance of Behavioral Health in an effort for those to be scheduled. Currently, we have over, I think 70, maybe 75, 76 that are trained throughout the state on youth mental health first aid. But as I mentioned earlier, we're in our infancy stage as it relates to the adult module, and very much as it relates to the teen, as we're piloting just with the 2 school systems that we did mention.
Great.
Thank you. All right, so our next kind of thing that could help prevent suicide is therapy. Do we have anybody that wants to talk about therapy and suicide prevention?
I'd like to jump in. I do work as a mental health counselor and provide therapy through the organization that I work for, which is the Alabama Head Injury Foundation. And I feel lucky in this position to be able to offer counseling for free to our clients here at the organization. Throughout my short career as a counselor, I've just noticed the accessibility issues of trying to find good therapy, trying to find good quality mental health care. There are a lot of barriers that keep people from being able to just have someone to talk to about the stressors in life. And I think, like you were saying, kind of the silver lining of COVID has been that we've been able to go virtual with everything. I've gone virtual with therapy. I've got clients that are all over the state of Alabama. So as long as you've got a Wi-Fi connection, we can talk. And it's just amazing to see the change in people once they have someone safe to open up to. You can see literally all of that pressure fall away because they can share the burden of that pain with somebody else, and it really lightens that load. So I have really been lucky to see, what therapy can do in the lives of people that are dealing with depression, dealing with suicidal thoughts. Really, and one thing we talk about in the training that we do is just having somebody there to talk to. That lowers the suicide risk so much because it alleviates that pressure and it builds that connection. So obviously, as a therapist, I'm biased that I think therapy is really important. I say that everybody could use a therapist, and I definitely swear by that. But especially, in the more rural parts of our state, or people that may not have access to the resources that a big city would have. I'm glad to see that there are more virtual options popping up. There are some good websites online where you can sign up for online therapy. There's like BetterHelp and I think Talkspace may be another one. You can look online, but I am glad to see the increase in accessibility for therapy. I think that's been huge. So, yeah.
I absolutely agree. Any other comments on therapy and how therapy can be helpful? I guess another kind of like therapeutic thing would be support groups. And I know myself and Miss Lydia Barber, we both run a support group for suicide survivors of loss. So people who have lost people to suicide, we have a support group for that. Did you want to talk more about that, Lydia?
Yeah, I'll say a little bit. After I lost my son, and a friend of mine had also lost her son, and we joined a couple of groups, and they were wonderful people, wonderful groups. And I have to say, it's not that it's worse, it is different. Losing somebody by suicide is a different kind of loss. And I want to stress saying that instead of worse. There's a lot of factors that go into it that are not prevalent with other losses, how horrific they all are. So we felt we needed to start something that we can all relate to and we can all talk to each other about without feeling, oh, I can't talk about this anywhere, So anyway, I went on AFSP and they help with these groups. They do not, what's the word? I don't know. Anyway, so they provide all the brochures and things like that. But it was us that started the group, and it's Eastern Shore Survivors of Suicide Loss group, and there's several around the state. I cannot tell you exactly how many, but I'm going to put a website, afsp.org/find-a-support-group. And you can put in your zip code. A lot of them are Zoom now or in person. We've had it for about 8.5 years, and it is in Fairhope. And right now we are Zoom and in person at the same time. We put a TV screen at the end of the table, and it works out really well. But anyway, it's just a safe place for people who feel they cannot otherwise talk about their loss, because only people that have been through this kind of loss can truly understand. And so it's been wonderful. We've had about 180 people go through the group forever how long. People stay there a long time. People just come for a few visits, because you know what? A lot of these people want to see other people and just say, I think I'm going to be able to survive this, because you really don't feel like you are right after it happens. So anyway, I'm going to put that site up there, and perhaps you can find one near you, or a Zoom one. So there you go.
Thank you, Lydia.
And Catherine Nicole Goggins, our Alabama program coordinator, has also started a suicide survivor group in DeKalb County. And it's a small group. It meets monthly, but if anybody needs information about how to get a group started, both Julie Smith and Nicole Goggins went to training to be able to start up groups, so they can give you some advice if you're looking for something along with AFSP. But it's been a relatively small group, but successful. Of course, we're in a rural county, And they've been meeting regularly for, I guess, about 2 years now.
That's wonderful.
That's so informative.
I guess I want to comment too, on that whole discussion of, therapy, it is really important to, whether it's individual or groups. And I spend a lot of time, especially in some of the courses that I teach, like abnormal psychology, and we talk a lot about therapy and finding the right fit. And that makes me think of, resources and discussion. So a lot of people have a bad image of therapy or support groups because they've had a bad experience or people have told them things in their life. So a fair amount, I think, of, the benefit is really discussing with people, well, what this is, what it isn't, and then finding that right fit. And I know for me, I try to connect students with the right fit of a therapist. And so oftentimes they'll come and talk to me about what's going on. And if it's somebody who's, just lost somebody to suicide, or if it's somebody who's dealing with bipolar, right, finding or connecting to that right fit is really important. And I know with the SAM Foundation, they have sponsored these scholarships for therapy, which I know many of my students have really benefited from. So providing those to students or just anybody in the community, especially in the rural areas, is really, really important.
Yeah, I agree. It's like any relationship. You kind of have to vibe at some point in order to be able to tell like your deepest, darkest stuff too. Yeah. All right. And kind of going along the lines with like therapy and support groups is also like crisis conversations, right? And so we all know about the National Suicide Prevention Hotline. It's actually answered in 3 different places across the state. So it's answered here in Mobile at Lifelines Counseling. It's offered all the way up in Birmingham with the Crisis Center, and it's offered in Huntsville as well. And Shannon was going to be with us today, and unfortunately she couldn't. But like that line is 24/7. You can call at any time, even if you are just like, you know somebody, you have questions, you yourself are dealing with it, or maybe dealing with some depression, anxiety, just needing somebody to talk to, any crisis call, you can absolutely call that line and talk. And recently, Alabama and really the United States as a whole has been trying to get into this new 988 initiative. And I think Ms. Ford would be perfect on talking more about that.
Sure. Thank you, Catherine. So there are 4 questions that come to mind when talking about 988. I'm pretty sure many individuals want to know exactly what is 988. 988 is a safety net for people experiencing a mental health or suicidal emergency. The Alabama Department of Mental Health was able to secure funding from Vibrant Emotional Health to assist agencies. As Catherine mentioned, they are a part of the agencies that we assist, which is the 3 Lifeline member centers, in planning for the implementation of a new national 3-digit number, 988, for mental health crisis and suicide response. The new 988 number will be routed to Lifeline's current number, which is 1-800-273-8255. The 988 number will replace Lifeline's current number as the primary number marketed to the public for mental health and suicidal crisis. Nationally, this initiative will be implemented in July of 2022. So the next question is, who should use it? So once 988 is implemented, if you or someone you know is having suicidal thoughts, experiencing delusions, or displaying severe symptoms of mental illness, then you should call 988 instead of 911. Why do we need it? Well, we time after time, we see an increase of individuals that have mental illness. They are being arrested, and they also are being admitted to the hospital. So we want to make sure that we are reducing those number of arrests and also decreasing the frequency of admission to those hospital emergency departments. Last but not least, what is needed to make 988 work? It's fairly simple. We need to be able to implement a crisis system. So this includes your crisis call centers, your Lifeline member centers, someone to talk to. And this goes back to what Katie mentioned about therapy, having that someone to talk to. This includes regional 24/7 clinically staffed crisis centers that are able to talk to that individual in need of who's in the need of a crisis. That also includes your crisis mobile teams. That's someone to respond. And last but not least, you need your crisis receiving and stabilization facilities, which is a place for those individuals to go.
Thank you, Megan. Yeah, I think 988 is huge, and I'm like Katie, I'm a bit biased. So, I think that getting that information out and making it as easy as just dialing 911 is going to be so beneficial. Because even though I answer the hotline, I forget like the big drawn out number. And so just having that quick at any time I can call is definitely beneficial. All right, and last but not least, when it comes to suicide prevention, I kind of want to talk about the Suicide Prevention Network of Alabama, and I know there's like 5 of us on here who are a part of that. So I'm going to let our president take off and talk about it first.
Well, and I wanted to start off by going backwards a little bit back to the therapy thing, because I just wanted to mention that I tell all of my clients about the Suicide Lifeline because it's accessible from anywhere. It's free. You can stay anonymous if you want to. I mean, it is something that everybody can use. If you have a phone line, then it's kind of like having therapy over the phone. It's not a good replacement for therapy, but it's good if you don't have access to therapy. So that's my little plug for the crisis line is that, I tell my clients just if you need someone to talk to, and Lydia just posted the text number as well. Thank you for doing that. I just say, like, if you need someone to talk to, there is someone to talk to. You don't have to carry that weight alone. So that's my soapbox on the crisis line. But just thinking in general about trying to get suicide prevention resources, education, advocacy across the state. That's kind of the theory behind us building this network, because we have all of these great organizations. We have AFSP, we have state departments, we have universities, we have counseling centers, we've got nonprofits. Everybody is doing similar work. We're all moving in the same direction, but we are doing it separately. So the idea behind the network is to really build support among our organizations so that we can be more effective. And I know that has been something that's been helpful for me in working in suicide prevention nonprofit. I mean, I love partnering with other organizations. Like I volunteer with AFSP doing the Out of the Darkness walks every year because I just think they're such amazing events. I have done PPR training for the SAM Foundation. I've attended some of their training. It's just really cool to see how these partnerships really assist all of us in the work that we're doing. We can share resources. We can be more streamlined in our approach to reaching people. And my main thing is that I just want people to know the resources that are out there, because personally, thinking back about my high school experience and my depression with my depression, my suicidal thoughts, I didn't know that there were resources out there that could help me. I thought that therapy was, I had that stigma in my mind. Therapy is for crazy people. Therapy is if you're like really extreme, and I'm just, I've just got this pain on the inside that I don't have anywhere to turn to. So personally, that's where my passion comes from, is just wanting people to know there are people to talk to. There is help. You don't have to be alone, and letting people feel that love and support.
Thank you, Katie. Any other comments on SPNA? Because I know there's a lot of members up in here. Harold, I think you're muted.
Okay, here we go. One thing that I've noticed that's been a positive regarding SPNA is the ability to not only bring the people that are in the agencies that are normally involved, like the Department of Mental Health, Public Health, AFSP, NAMI, those type of organizations, but also the organizations and individuals that come from a background of lived experience. And there's so much going on that a lot of times these smaller organizations don't have a way to leverage what they would like to do. But in bringing this organization together, we've run across, well, SAM Foundation was started by people with lived experience. So was Marty Sutton in Lawrence County, Maximizing Mental Health in Gadsden, Behind the Smile in Gadsden. I've just run into all these different and various organizations. And a lot of times those people just don't know what to do to further the effort. And so it's given them an outlet to look to get involved, get a deeper involvement. And so with the number of suicides we have in Alabama, the number of attempts we have in Alabama, there are a lot of people out there that would like to do something, just don't know how to go about it. So if they can get in, and we take anybody into the SPNA organization that has a desire to, any desire to do something about suicide prevention. So it's a great outlet for that.
Yeah, I want to say it's also a very positive community, being involved with SPNA and all the organizations. Everyone has always been very welcoming and supportive and kind. And so, that not only just those who want to be involved, that helps, I think, people feel more comfortable being involved, but also being a part of it, you just feel welcomed all the time. And so it just kind of grows. Like, you don't want to leave because it is such a good experience, and it's such I want to use the term healthy because that seems kind of therapeutic, but a healthy dynamic within people who are trying to make a difference.
Yeah, I agree with all of those things. I really have enjoyed being a part of SPNA as well, and serving on the board. I just think there's a lot of initiatives, and like Katie was kind of saying earlier, we're all kind of working in our silos. And why create the wheel all over again when we're all doing the same work and we can create it to a bigger extent? So we've all kind of talked about what we've been doing, but for the audience members, what can they do to help or support or anything like that?
I think some practical approaches that we would love to see happen just in the general public is just, number one, the minimization of stigma. That people understand that we're not trying to normalize suicidal ideations, completions, or even attempts, but we're building and hoping to foster compassion so that in the absence of knowledge, we can at best be mindful of the fact that we're dealing with individuals and not with cases per se, and that we're dealing with people who sometimes are in threatening situations that could encourage them to have thoughts, but are not always permanent, meaning an ideation doesn't always lead to a completion. And I think one of the best things we could ask everyone, the world at large, to do is to educate yourself on something as basic as the vocabulary. Know what it means when someone mentions having a suicidal ideation, that the base word of an ideation is an idea. That simply means that a person has an idea to want to end their life by suicide. But again, that doesn't have to lead to completion. Also know about attempts, that it is an act towards completing, and then be sensitive, I think, as it relates to how we discuss suicide as a topic as a whole, rather than stating one would commit suicide with its punitive connotations. Let's be more compassionate to say that a person may choose to end their lives by suicide, or that a person has chosen to die by suicide. Those are basic things that we can just ask individuals around us and even begin to make that a part of our own vernacular so that it can become something that's common around the areas where we work, even with our family members and friends. Let's talk about it. And I think that's, for lack of a better term, that's the phrase that we use anyway, but let's really talk about it from a perspective of acceptance, and not acceptance of the act or the ideation so much as acceptance of the person for where they are in that moment.
I think that's great. Thank you, Shondelyn.
Exactly, like if they understand, have a real conversation about suicide. Do not be afraid to mention the word. Do not be afraid to question them straight out. I think so many people are so afraid to even mention it because they think it puts it in their head, and we all know that's not true. It's already in their head, and asking them to talk about it lets them know that somebody is caring about them. And somebody sent me today something about on that terms, but you're exactly right. Education, watch the way you speak about suicide. Commit suicide is a no-no. The words. So yeah, there's a lot of education that can go on. There's so many resources out there that people can learn about suicide nowadays. Absolutely.
I think just attending stuff like this, like whoever's watching, thank you for taking the time to do this, because the more that we can just get information out there about what mental health looks like or needs to look like, the better our whole community is going to be. And I think part of what goes into that too is taking care of your own mental health. So again, bias as a therapist, go to therapy. But seriously, I think that the more we learn about how to take care of our mental health, the more that we can be there to support other people, and we can help them get connected in ways that they can take care of themselves as well. So I think that if you take care of yourself, the fallout is that it's helping kind of support your community as well.
Yeah, and I think knowing your limitations, we talk about trainings and how to speak and how to connect with people. And sometimes, some people just aren't quite comfortable yet, and that's okay. And so just knowing that, okay, I can connect somebody to somebody else who can help them. So maybe I don't quite feel comfortable yet, but here, these are these numbers, I can sit with you and we can call together because I'm just not sure what to do, but I know this other person will.
And I think encouraging people to do something as common as trust your gut. We know people around us, and we know their normal behaviors and their normal actions and responses. So if you see something that's not quite what you're used to seeing out of an individual, take note and really trust your gut. While you may not be able to immediately provide all of the resources at once, at least you could tell somebody, especially if you know that their behaviors are outside of your own wheelhouse. Trust your gut, because likely all of us have our own measure of discernment and instinct that likely is right. And I think that that will help in trusting your gut, to not have to look back and think, hindsight being 2020, if I had only acted on what I thought I saw, what I thought I knew, but I wasn't really trained. Diffuse that thought and really just move forward with what you know. Your gut really won't lead you wrong. It's probably not the most therapeutic term or phrase, but it's the most normal one in this sense that people can identify with, that you have to just trust yourself, especially with what you see with the people that you know.
Another thing people can do on their own or in collaboration with others is advocacy. We're particularly in need of advocacy at the state level to get state level funding, line item funding. And with the expiration of the Garrett Lee Smith grant in 2021, I'm sorry, this month, in fact, that's going to leave a big hole in our budget for suicide prevention across the state. And we advocate with the AFSP, and they do a wonderful job, provide all the materials, and you just have to show up and get a little introduction on what you're doing. And then you go around and talk to legislators and their legislators, and they're normally very open to what you have to say. But we desperately need some state level funding to maintain funding through the lean years when there's no federal funding available.
One additional thing I just wanted to mention is just thinking in terms of people who are thinking about suicide suicide is not the problem. And I think that's part of like the advocacy and education, is learning that suicide is a result of the problems that are going on within that person, whether it's depression or dealing with trauma, systemic issues, poverty, isolation, all of these things that build up are the real problems for us to tackle as a community. And suicide is the result of that pain kind of festering inside of a person. So to me, this isn't just about suicide prevention. This is really about taking care of our community in a bunch of different ways. So any kind of advocacy, any kind of support that you do to help the community, I mean, really, that goes into suicide prevention. I'm thinking of like this quote that I see on Instagram all the time that people post, like, suicide prevention isn't just a hotline. It's about education. It's about social services. It's about healthcare. It's about, you know, fighting the isms, racism, sexism, homophobia. All of these things to me are essential parts of suicide prevention as well.
I also wanted to mention that there are at least 19 community mental health centers located throughout the state as well. So if you are someone that is experiencing a mental health crisis or suicidal crisis, or it could be substance abuse, please make sure to go to look on our Alabama Department of Mental Health website and see where your local community mental health center is located.
I think those are all powerful, powerful things. Just being an advocate, being like knowing the current anything about suicide prevention, volunteering any way you can, even just being there for that person, right? Sometimes you don't even have to say anything back. I think in society, we are so used to like listening to respond instead of listening to actually hear. So even just that minor change can make such a difference. All right. Well, let's talk about some awareness events, typically one that is coming up next month.
Yes. Well, there are 7 Out of the Darkness walks throughout the state of Alabama happening in October and November. I've already put up where to go, afsp.org/walks. They are Florence, Huntsville, Tuscaloosa, Birmingham, Dothan, Montgomery, the Daphne, Mobile area, and I already said Tuscaloosa. And these are wonderful events. There's about 500 plus throughout the United States. It's a fundraiser for the American Foundation for Suicide Prevention. However, in your community, it is to make everybody more aware about suicide. We have lots of resource tables that are set up. I will preface this by saying last year it was virtual, so we are going to go by CDC guidelines and make them as safe as possible, but all of them except for one, and I think it may be I'm not sure. One of them is maybe Dothan. No, anyway, one of them is virtual, the rest are in live. But we have resource tables. We have a memory wall. So yes, people can actually put up pictures of their loved ones so that you can put a face on people who have actually taken their lives. So we also have the walk, the actual walk, which is nothing strenuous. It's just a nice little walk around the community to let the community see how many people care about this, and again, make them more aware. And most of them do end up with like a butterfly release, which is always a sign of hope. So it's very uplifting. It's people come away from it saying, I had no idea. First of all, I had no idea. I thought I was the only one that had these thoughts. I thought my son was the only one. I didn't realize all these, people up on this wall. So it's a wonderful one. And if you're near any of these, get on their websites. Usually it's afsc.org/ in the name of the town. And of course, go to afsp.org/walks. And go to one and just see what it's all about, or form a team, because that's how you can really help them out. Because it is a fundraiser, and they were hit very hard. I will say this, nationwide last year. I think they raised only 40% of what they normally raise. And that's a huge hit for something that's a lot of people don't understand. Why are you raising money for suicide prevention? They don't understand all the research that goes into it the education. We talked about the advocacy and the suicide support, suicide loss support. So it's an amazing event, and takes place in the fall, and in the spring colleges you have them. So there's always one near you.
Thank you. Yeah, definitely reach out again with the face thing, like, and what Katie said earlier, this is a person, right? We are
Yes.
thinking about people, not just a statistic, not just a number somewhere, but actual people.
Right.
All right, so I think we have 5 minutes left. Kelsey, Chanel, do we have any questions from the audience?
No, as of right now, no questions or comments from the audience.
Perfect. I guess just closing remarks. Does anybody have anything else that they want to say?
Appreciate y'all having this, Catherine. And also want to express my appreciation to Katie for her continued diligence in bringing SPNA together. I think she does a wonderful job.
I agree. Yeah, thank you all for coming and attending and just letting our beautiful state know what's going on and how we can help and how they can help. All right.
Absolutely. Are there any important phone numbers, hotlines, emails that need to be kind of said before we leave today?
I'm going to put my email in just if anybody has any questions about any of this.
Okay.
And anybody out there too. I respond fairly quickly. So I'm just going to put my email there for
Okay,
any
thank you
information
so
about
much.
anything.
Okay.
Yeah, I would encourage everybody, if you're comfortable, you know, or your website or anything like that. Absolutely. All right.
All right. Well, again, thank everyone for being here today. Such great information and such passion behind everything that everyone is doing. I know that even though we did not have any questions or comments in our chat, that someone was definitely touched by this panel and everything that you guys are doing across the state. So again, from Lifelines, we greatly, greatly appreciate you. And to our audience, thank you for being present with us today. So again, until next time, everyone take good care.